We did an FUT strip procedure. This is the patient's second procedure. The reason that he came back was because he was really happy with the first procedure, but he is a Norwood 6 with more significant balding. We concentrated on the front, and what that did for him on the first procedure was really give him some coverage in the front, so when people look at him, he doesn't look like a bald guy, and he looks like a guy with thinning hair. Doesn't changes the whole perception, helps to frame his face, give him a total different look. So now we came back for a second procedure where we were able to add some more coverage on the top and the crown. Lighter coverage, but it really did help. We did the second procedure where we removed the original scar from the FUT strip procedure and replaced it with the secondary procedure. So that was what we did starting in the morning. Later on in the day, saw some very interesting consults. Patients who were thinning in the front and the top and the crown, requesting medical and surgical intervention to help to treat that hair loss. It's important to note that when I speak to patients who have more significant balding, they may be interested mostly in crown coverage. However, it's important that we work from the front back, because it's permanent hair that we transplant. So just to place it in the crown, and if they lose more hair in the front and the top, doesn't really look natural. So we want to work from the front back and provide good coverage in the front, and we taper as we go back, and on a subsequent procedure we can add more coverage to the crown area if possible. So we saw several patients for PRP treatments. Several of these patients today actually were on their maintenance, so we had done the first several treatments. That brings us to the first 6 months, and we evaluate, and if things look good and are going well in terms of maintaining and helping to thicken their hair, then every 6 months then we do a maintaining PRP treatment, which is what we were doing today. We saw several patients who were on their maintenance, but they've been doing it 6, 7, 8, 9, 10 times, and we're keeping it going because we're seeing very nice results. Saw some patients who may not have been a candidate for hair transplant because their donor area, they didn't have sufficient donor hair to perform a hair transplant. So that's one of the reasons why someone may not be a candidate, and I explain that to them and I show that to them. So I examine their donor area with a dermatoscope, and then once I deem that they are not a very good candidate, I give them a mirror and I show them with a mirror behind them, and I point out exactly why they're not a candidate, and I want them to know the reasoning behind it. So not everyone is a candidate. It's a minority of people who are not candidates, but it's important for them to know that. So some very interesting conversations. Procedure went great. Everything went really smooth, so it was another really good day providing consultations and hair restoration procedures.